as the Secretary of Health and Human Services. I will vote no on Trump's NIH director. I will vote no on Donald Trump's FDA commissioner. I will vote no on every one of Donald Trump's nominees for everything. I am going to vote no. And I'm going to vote no to a funding plan which the Republicans want to put on the Senate floor that will gut the health care programs of this country that serve every single American. I will vote no. And we must make sure that we put the Republicans on record that they are going to try to destroy Medicaid and Medicare and education programs and clean air and clean water and food for kids all across our country. We're going to make them accountable. We're going to make sure that they have to pay the political price. So they think we're knocked down. We are not knocked out. We are up. We're going to fight, and we're going to win. We're going to win. We just have to keep this message out there. We have to make sure that they know that these programs are essential for everyone. The past is just a memory. The future is the hard reality of the poor, the sick, the elderly, the disabled in our society. We have to make sure that a nostalgia for a time that never existed is replaced with the idealism that we need for all of these healthcare programs to be protected. Thank you all so much. You cannot make America great again by making America hate again. We're going to fight them every single step of the way. Thank you all so much. Let's go get them.
When we fight, that's right. Thank you, Senator Markey. Truly an advocate for us. We need more people in Congress like him. So will you consider running? All right. You know what I love? The phrasing, make America sick again, which is massa. Is anybody surprised? Right? Anyway, okay, so we're moving on. We got a lot of great speakers. So coming up, we have Gina from MPA, Fari from Spaces in Action, and Frankie Clark from Action NC.
Hey, everyone. So this proposed $880 billion to Medicaid is going to hurt everyone. Suffering and the most vulnerable in our nation are going to hurt. I have been disabled for almost 25 years. At the age of 30, I was diagnosed with a very rare disease called Cushing's. A year later, I had both of my adrenal glands removed. I live with Addison's disease. Without Medicaid, I won't be able to afford to see my doctor. This prevents me from getting my meds prescribed to me. These same medicines are what keep me alive. My access to Medicaid is how I am able to afford these prescriptions. Therefore, having Medicaid is life or death for me. Do what's right for your constituents, because everyone deserves the right to care. Thank you.
Jumbo Juana! On behalf of our great nation's capital, I am Fari Gamina Tumpe,
health equity organizer with Spaces in Action, multi-generational caregiver of differently abled family members, and I too live with several autoimmune disorders, but very honored to put my foot on the necks of bad actors as a national member of Popular Democracy. I have come to rely on Medicaid for my differently able family members, and I have had incidents, many of them, of being denied authorizations for expensive and crucial mental health medications for my grandchildren. It was denied by Medicaid. Let me hear you say shame! 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 Right-wing Republicans are holding the U.S. economy hostage. They are weaponizing the need to increase the debt limit and demanding massive federal spending cuts to Medicaid. There's also the proposal of the expansion of so-called work requirements for Medicaid and federal anti-poverty programs like SNAP, WIC, TANF. The Economic Analysis and Research Network has already documented why these requirements don't work. Instead, they inflict harm on the people with the greatest need. If the rich succeed in forcing this deal, millions of people will have access to their basic health care and food put at risk, while boosting billionaire corporate profits. We tell the world that we are the land of the free and the home of the brave, but we live in the land of racial capitalism and the home of systemic oppression. In spite of it all, our resilience shines through our souls. People shouldn't be poor because they're sick or sick because they're poor. Because health care is a right and not a privilege. Say health care is a right. Health care is a right. Health care is a right. Say health care is a right. Health care is a right. Say it one more time so I can find my spot back on my speech. I'm not going to worry about finding it. I just want to say, together we fight, together we win, we're stronger together. And we must keep moving our money. Say, move our money. Move our money. Say, move our money. Move our money. Say, move our money. Move our money. When health care is under attack, what do we do? Stand up, fight back. I said, what do we do? Stand up, fight back. What do we do? Stand up, fight back. When health equity is under attack, what do we do? Stand up, fight back. What do we do? Stand up, fight back. What do we do? Stand up, fight back. When your dignity is under attack, what do we do? Stand up, fight back. What do we do? Stand up, fight back. I said, what do we do? Stand up, fight back.
Good afternoon. I said good afternoon, people. Good afternoon. My name is Frankie Clark, and I represent North Carolina Action. senior health care warriors. And they call us health care warriors because we've been on the fight for health care in Action, North Carolina. So I'm here today just to tell you my story. I am one of those people who get Medicaid and I get Medicare both. That's because of my income level. It's all based on your money. And so in getting this care, I need Medicaid not to be cut because I need Medicaid to sustain me, to keep me alive and healthy. I am 80 years old and still able to live by myself, to take care of myself, but I have health issues. And my income is not enough to pay private insurance. Okay, because I get the Medicaid, I qualify for Medicaid and Medicare. It provides me because I have glaucoma. It's an eye disease that you get sometimes when you're diabetic and sometimes when you're not diabetic. And so I have to see specialists 3 times a year. And without Medicaid, I wouldn't be able to do it. I'm a diabetic. I have high blood pressure and all of that. And I need the Medicaid and the Medicare. The Medicare is part of Social Security. So if Social Security get cut, you won't have any medical coverage either. So I get Medicare, but Medicare is not enough, especially if you have vision problems, dental problems, and so the Medicaid supplements, the Medicaid comes in and pays for the care that I need to see the specialist. I need that. And without it, without the Medicaid, if Medicaid get cut, I would be lost. I wouldn't be able to go see my specialist for my eyes. I could go blind. It's not right. It's wrong. It's not right. It's wrong. It's not right. It's wrong. Every human being is entitled to health care. We are supposedly the greatest country in the world. We have a good health care program now that's working. And without the Medicaid supplementing many of the Affordable Health Care Act, many middle-class Americans wouldn't have any health insurance. And because of the rules set up, see, before when the private insurance companies handled it, you couldn't have an existing disease. They could deny you, so you couldn't get any health care anyway. So now at least families all over America can have some health insurance to cover them because of Medicaid. Don't cut the Medicaid because you're killing people. You know what they're doing. You know what they're doing. It's the reverse. I'm about ready. I'm about finished, honey. Listen. Yes, ma'am. Listen. You know what it's done. Hey, you gave me the light. Oh, God. Hey, I'm trying to tell you people, we need to fight as long as you have breath in your body. We need to stand up. You know that because of the denial of the health care, because of the cuts, it's going to hurt so many millions and millions of people. One of every 6 person in America needs Medicaid, and they depend on it. And the thing about it is that it crosses all racial, cultural, nationality lines. It's about class. They want to divide, and what they're doing is they're doing the reverse of Robin Hood. They're robbing from the poor to give to the rich. They're robbing from the poor to give to the rich. Do not cut our Medicaid. Do not mess with our affordable health care. I'm telling you, Almighty God, see you.
Mic drop. Almighty God sees you, right? That's right. Because I see that sign right there that says, Jesus said, and I am not religious, but he was a good dude. Jesus said, feed the poor, heal the sick, and love thy neighbor. Because love, not hate, makes America great, right? That's right. That is right. Okay, we got another individual here, another one of my resistor sisters, okay? They actually, last summer, they adopted me into the squad. They said I was the Alaska squad. I felt all special and stuff. So, that's true. Healthcare is a human right. 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 With that, we're going to introduce somebody that knows that to her bones. Representative Rashida Tlaib.
Congressional Mamas Caucus. And I know with Medicaid, it means life or death for mothers giving birth. We know that for many, many of our children, from the prenatal care to the post-birth care is incredibly important. But here we are right here, where Republicans want to ram through, not millions, but $4.5 trillion in tax cuts for billionaires and powerful corporations. You know, corporate greed kills. It is a disease in our country. It is obvious to me that they prefer to, again, put profits before people. And in order to pay for these tax breaks, later basically giving away our money, they want to rip health care away from millions of our families. It is shameful. Shame. You know, I have colleagues throw it up and say, well, this budget proposal doesn't have the word Medicaid in it. Yeah, okay, we ain't stupid. We understand what nearly $1 trillion out of Energy and Commerce Committee really means. Stop lying to the American people. Some of you have over 50, even some is over 60% of folks that depend on Medicaid. So when we say fund care, not billionaires, we mean it. You know, I know nearly 80 million people around the country depend on Medicaid and CHIP for health services. I know so many of our families have been working so hard to combat Black maternal health, infant mortality in our community. I mean, it's like we get a foot in and they pull back. For those that rely on Medicaid, you all know it's not just a service or coverage. It is a difference between life and death. But right now, we all know the future of our Medicaid system is under threat. You know that under the Republican budget, more than 250,000 people alone in my district would be risking that health care coverage they need. You know, they act like we plan to get sick. Really, they act like we're just sitting around here and we're like sponging up. What are you talking about? Who likes to go to the doctor? You know what I mean? Like, and we have sick care in our country, not health care. They don't have the courage to take on big pharma and the healthcare industry that literally feeds on profit and greed. But here we are, here we are. Here we are, them treating us like we're just numbers. These folks are our neighbors, they're our friends, they're our families. Have you ever talked to a father that lost the mother of his children giving birth? Have you ever talked to a person that continues to say, even the Medicaid system now isn't even covering my prescription drugs? And they want to just take the bare minimum that they're even giving to my residents. It is shameful. Now, this is where I get emotional. You know, I'm the eldest of 14, mashallah. I'm the eldest of 14. And I've been taking care of people all my life. And when I think of the babies, the children, and it's unbelievable that we would literally sit here and think that giving this $4.5 trillion to these corporations while leaving our children out there, some of them, again, unhoused, so vulnerable. You know, they act like it's so easy to get health care in our country. It is worse than hard. It is unbelievably immoral and inhumane, our system here. And here they are trying to fund billionaires, not care. Now, I want you all to make no mistake. This is an American issue. I can tell you every corner, every congressional district has folks right now that are on Medicaid that will be hurt. Even a minor cut. Do you understand? Even a minor change is going to, again, matter of life and death. I've already seen it where folks can't afford their prescription drugs, rationing. A mother coming before our committee, twins rationing literally the insulin, losing one of her children at 6 years old. How does a mother live after that? But they do their best. You know this. Many tell me I'm doing my best. And here they are, again, choosing the billionaires and the corporations before the people that they're supposed to represent. We must continue to raise our voices. I remind people, you know, I come from the most beautiful, blackest city in the country, the city of Detroit. And every corner, I kid you not, every corner, if you feel down, come to my city. You'll leave wanting to just come up here with so much strength. Every corner of my district is a reminder of this. That institution, it doesn't move until you make us move. That's right. That White House, that president, you think they wake up, oh, you know what, the Civil Rights Act that's a really good idea. People marched. They demanded that change. You think the right to organize unions came from the White House or Congress? No. It's when people withheld their labor. It's when we demanded that change and that protection. People were dying, and they still do at work. They wanted human dignity, and it was the people that organized in the streets. We showed up with our bullhorns, with our voices, with our real lived experiences, and we held them accountable. We didn't disappear. We didn't shy down. We were unapologetically speaking truth to power. There's a reason that a lot of my colleagues don't want to have live what do they call it? Town halls. Yeah, I know. And, thing is, they all have offices that can take meetings. They all have hospitals, clinics, centers. So many of them have seasoned residents in their community. They need to raise their voices and speak up about what this really will mean to their community. It is devastating that some people are thinking, you know what, just let it happen and see what happens. I said, no, I don't want anybody to die. So we're going to fight to save lives. We're going to fight against the corporations. We're going to fight against corporate greed. Because guess what? They are underestimating the people here. They are underestimating how much we love our communities and love our neighbors. Because hell, if they won't do it, we'll take care of the sick. We'll take care of our children. You know how? Because we're going to make that institution move. Because I want you to repeat after me. Fund care, not fund care, not fund care, not fund care, not Let's go save some lives. Thank you so much. I don't know about you all, and for my seasoned residents here, how many of you have been doing selfies? We're about to do a little selfie with you all. Is that okay? A little Aussie. You ready? Ready? When we fight, we win. When we fight, we win. When we fight, we win. Thank you. You know what, y'all? That is right. Stand up. Fight back. Stand up. Fight back. Stand up. Fight back. Stand up. Fight back. We are going to fight for our communities. We are going to fight for our children. We are going to fight for our grannies. We are going to fight for our dignity. Y'all, today is not the stand that we take today is critical and important. But the truth is, we got to carry this message across all of our communities. So I want to know, I'm going to put you all on the spot right now. Be ready. You ready? All right. I want, if you are ready to go talk to your neighbors, to go talk to your family, to make a call to your Congress member, to send a letter across community to maybe write into the paper, I want you to put your fist up and say, I am ready to fight for all that I love and must protect. I make a commitment to my community, to those around me, and to justice. I am glad to stand in community with all of y'all, my beautiful people. I should introduce myself. Ooh, I'm having a hot flash. Oh my God. Oh, I think some people in the audience may understand what I'm talking about. Yeah, you may see steam in a minute. Thankfully, it's not that cold. Y'all, I am excited to be able, first of all, my name is Ana Lilia Mejia. I know that's a lot of vowels. All you got to remember is when we fight, we win. All right? I have the privilege to be co-ED of the Popular Democracy, which is, frankly, it's all of us. All right? Our commitment is to stop this massive transfer of wealth from those who live at the expense of the American people and those who are left to build our lives at the margins. This idea that even some of our quote-unquote friends in the Democratic Party, this idea that they could play possum, that they could just stand aside, that they can just allow the madness to happen because they believe that they'll be able to own the fallout later. But guess what? We are the fallout! We are the collateral damage! We refuse to be pumped into the grist mill without a fight! Are you with me? I know who is down to fight. I see them spread everywhere as the daughter of a nurse. As the daughter of a nurse who, to be frank, y'all, I knew I had to be really sick if I tried to not go to school. Something had to be bleeding, falling off, or I was dead. But as a mother, as a daughter, as an activist, I want to share right now my mother is 81 years old, has dementia, and if it wasn't for the fact that Medicaid is there, I wouldn't be able to work. I couldn't even stand in front of you and fight for everyone else. If it wasn't for Medicaid, I wouldn't have the support that allows me to engage. Healthcare is a human right. Healthcare will be protected. Healthcare can be saved by all of us. Leading the fight alongside all of us at Popular Democracy, at New York Communities for Change, at Las Doñas, at Boco, at Casa, at all of these, Stand Up NC, Stand Up Action NC, Stand Up Alaska. We have one of the most tremendous unions and union leaders that is ready to put down, shut up, fight, anything we have to do, and that is the incredible Diane McClure, RN and Vice President of NNU National Nurses Union. Come on, Diane!
Good afternoon to my fellow champions for healthcare justice. Good to see you all here today. My name is Diane McClure. I'm a registered nurse and proud Vice President of National Nurses United, which is the largest union for registered nurses in the country. As a union nurse, I have long fought for Medicare for all, because we know nurses know that healthcare is a human right. As nurses, we see the consequences of our broken, profit-driven healthcare system every day. Our hearts break for the patients who have suffered without care because of high costs or denials by insurance companies, whose only interest actually is their own bottom line, right? As we continue to fight for Medicare for all, we are standing up today to protect one of the country's most critical public health care programs, and that is Medicaid. Medicaid is fundamental to the survival of 72 million Americans, 20% of the country's population. Look around you. That's 1 in 5 people. But the administration's cruel. Only in for themselves. It's literally ready to steal billions from the poor to give to the rich, as they demand to cut, let's hear it again, $880 billion for Medicaid to pay for a tax cut for billionaires. Shame! This is a knife in the back for people across the country, the biggest city to the quietest back road. We know what these cuts would mean. Elderly and disabled people would be robbed of the support services they need to survive. That's right. Millions could lose their ability to get anything but emergency care. Without Medicaid, we know patients won't get the preventative care they need either. Instead, they'll wait until their disease worsens, as we all know, before seeking emergency care, leading to serious illness and more unnecessary and preventable deaths. The cuts will touch us all. As the number of uninsured people skyrockets, so would wait times in already overcrowded emergency rooms. Our existing healthcare system will be incapacitated, much like what we saw during COVID, or even worse. Medicare represents nearly 20% of the spending on healthcare in the U.S. It provides critical funding to rural hospitals, public facilities, and safety net hospitals. Cuts to Medicaid would lead to more hospital closures and serious economic hardships for communities where health care is a major driver of the economy as well. We know Black and brown communities would disproportionately suffer the burden of these cuts and closures. We know the billionaire class is trying to silence us and degrade us and vulnerable people who might stand with us in this fight. But we are not going to let that happen. We know the fight for justice is a practice and not a destination. And we are using our collective power to put that into practice today. Working together and using the collective power of our unions, the workers, and the people is the only way to confront these assaults on our communities. I call on all of you to join me in the fight against the attack on us all.
Y'all, we are mounting a comprehensive fight. We have activists, we have union leaders, we have community leaders, we have young people, we have more experienced, seasoned people. Together, we are going to make this thing happen. I am so proud to introduce my sister from another mister, to tell the truth. My comrade in activism, who has been leading not only in action but in heart, the incredible, the amazing Jamila Healy from Be a Hero.
That's right. Yep. Absolutely, absolutely.
All in the same fight.
Yeah. I'm Jamila Headley. I lead Be a Hero. And we're a movement of patients across the country fighting for for guaranteed health care for everyone, the guaranteed health care we deserve. Over the last few weeks, people across the country have been writing to us to tell us what's at stake for them in this fight. I want to share some of those stories. Patricia in Delaware said, "My son would lose his day program, which would cause him to lose his nonprofit residential program. I cannot physically care for my 6'2", 240-pound son. It would be utter despair. This must not happen. Alice in Texas said, Medicaid cuts will kill me. Without medication, I would be unable to go on. The pain and depression would overwhelm me. Please don't let this happen. Donna in California said, Medicaid cuts would mean my adult son would have to go without his psychiatric medicines and would be unable to work. He has been near suicidal for decades, and I worry that the loss of Medicaid would cause him to entirely give up hope. Sally in Oregon, my sister who has cancer and needs monthly infusions as her post chemotherapy care would no longer get this treatment plan and would die. I want to tell you today what I would like to say to Patricia and to Alice and to Dana and to Sally. This, I know, it's outrageous and it's scary. $880 billion in cuts to Medicaid that the Republicans are proposing. But here's the truth. They have picked the wrong fight. Trump has picked the wrong fight. Republicans in Congress have picked the wrong fight. And Elon Musk, he has picked the wrong fight to try to extend their tax cuts for their billionaire friends and corporate cronies on the backs of our health care. Here's why, because there are 80 million people who depend on Medicaid and CHIP across this nation. We're talking about 1 in 5 of us, 6 out of 10 of all people in nursing homes, 4 out of 10 people with disabilities like me, almost half of all poor adults, and 80% of all kids who live in poverty. 4 out of 10 of all of our babies born in this country are born because they have Medicaid or able to be, given birth in safe settings because they have Medicaid. All of these lives are at stake. Without Medicaid, millions will not get the care they need. People will forgo going to a doctor. Hundreds of thousands of people won't be able to get the home care that they need to stay with their loved ones and to be in the communities with people that they love. People will not be able to take medications they need. If people do go and get the care they need, many will face bankruptcy and the cruelty of a bad credit score. But it's not just the people who are on Medicaid, who benefit from Medicaid, who are going to be harmed. Without Medicaid, 12 million people on Medicare won't be able to afford the care they need. Already struggling hospitals all over this country, particularly in rural areas, will begin to close. If these cuts go through, we will see community health centers shuttered all over our country. Cutting Medicaid is going to devastate all of us. Elon Musk referred to people who use public benefits like Medicaid as the parasite class. But he is the parasite. He is the one who has taken more than $38 billion of our taxpayer money to help build his businesses at Tesla and SpaceX. We know what he cares about most. He cares about his pocketbook. And now he and Trump are trying to pick our pockets, the pockets of millions of Americans, our state government's pockets, by trying to cut Medicaid. They're picking on Medicaid because they underestimate us. They underestimate the potency of our pain. This isn't the first time that they've done this. This isn't the first time they've underestimated us. In 2017, when Trump tried to hitch cutting the ACA to his tax bill, they underestimated us. And we came together and we fought. We showed up like we are in D.C. today, and we saved the ACA. And then the next year, in 2018, we took all of that fury, all of that pain, and in congressional districts around the country, we won back power in the House and kicked some of those spineless Republicans out of office. But here's the good news. Musk might be the richest person in the world, but this country only has 800 billionaires. There are tens of millions more of us. We outnumber them. And this is our power. This fight will be hard, y'all. It's going to be exhausting. But we can win. We can win. Back in 2017, my comrade Adi Barkan would often lead folks in a mic check. I've been thinking about him a lot these days. I want to lead you in that same chant today. So are you with me? Yeah. Mic check! Mic check! Mic check! Mic check! Mic check! We are here to fight! We are here to fight!
for this country that we love. Because we are stronger together. Because we are braver together. Because we are louder together. I believe that we will win. 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 That's right. I also believe that we will win, and we are going to win. Got it. This is community always looking out, always looking out. We will win through the efforts of every single one of us, our allies, and our community. I am proud to yet again introduce another set of allies that are down to stand up, fight back, and in recognition that health care is not just an issue of health care. Health care and the ability to access quality care, affordable care, responsible care, all of that has an impact on our housing, on our economic security, on our ability to parent, on our ability to care. And so we have two organizations that are at the forefront of this intersection, ready to stand with us. I am glad to introduce Nicole Jorvik from Caring Across Generations and Dr. Vate, forgive me, Dr. P, Vate P, from Housing Works. Come on, fearless leaders!
Thank you. So yes, I am Vati Poitvien, or Dr. P for everyone. I am here in front of you as a physician. I'm a physician in a community healthcare, and I have decades of experience seeing the power that Medicaid has to transform lives and to provide life-saving services for millions of Americans, as we heard today, but for my patients, Medicaid is a lifeline for us.
She saved my life!
Yeah, I hope I did. So I'm here today to represent the voices of my patients because our lifeline is under attack. I'm here today to speak for Ron. Ron is 24 years old. Last month he got diagnosed with HIV. Ron left my clinic with life-saving medication thanks to Medicaid. And Ron went from despair to hope. I'm here to talk about Liz. Liz is 50 years old. She's beautiful. She lost her health care coverage when she lost a job. And she lost her job because she could no longer work. She was developing paralysis. But guess what? Medicaid stepped in, and Liz got the diagnosis and the treatment she needed. And now Liz is better. You see, because those cuts, and we heard it the whole day, they're not numbers on a spreadsheet. They are people. They are lives. These numbers are women that will lose prenatal care. They are children that will lose their immunization. Wait a second. They are seniors that are going to lose their care. They are veterans that are going to lose their care after fighting for this country. These cuts are cruel. They are cruel and immoral. Because it is immoral to force people to choose between food and medication. It is cruel to force people to not get the care they need. But I'm going to tell you what, this is not the worst with those cuts. They are, and listen to that, fiscally stupid. They are fiscally reckless. They are fiscally foolish. Because Medicaid provides preventative care. And when you cut it, what happens is that people with preventable condition gets into the emergency room, and all you do, it pushes up to the hospital. So there is no real saving. It's just cruelty. And we will not take it. Let's say no to the cuts. No to cuts to Medicaid. In the name of the people we serve and the people we love, we will push this. Thank you.
Medicaid definitely saves lives. My name is Nicole Jorwick. I am the Chief Program Officer for Caring Across Generations. We work on behalf of family caregivers, care workers, disabled people, and older adults to change the way that we support and value care and caregiving. And this includes why I'm here today. At the center, we have to protect Medicaid. Unfortunately, Medicaid needs protection right now because some members of Congress, President Trump, and the used car salesman Elon Musk are attempting a reverse Robin Hood right before our eyes, trying to steal money that provides health care and so much more to give that money to the rich, not on our watch. Medicaid matters. Medicaid is a health care program providing coverage to over 80 million people, as you've heard. It supports a wide variety of people, from people with disabilities, older adults, pregnant people, children, and people with low incomes, and is essential to the well-being for people at every stage of life. While Medicaid is primarily a health insurance program, it is so much more than that. Medicaid is an education program. Do you know that Medicaid funds the vast majority of supports and services and therapies for disabled children in school? Medicaid is the long-term care system in this country. That's right, Medicaid, not Medicare, is the main funder for access for aging and disabled people to live in their homes and communities. Medicaid is also a workforce program. Medicaid pays for the wages of 70% of direct care workers. Medicaid is also a state funding source. Medicaid accounts for one-third of the federal dollars that's going into every single state budget. Medicaid is all of these things, and yet it remains a target for the massive cuts that you've heard about. At least $880 billion, thanks to the budget resolution that passed the House a couple weeks ago. We must fight back. If not, millions will lose coverage. Waiting lists for desperately needed home and community-based services for disabled and aging adults will grow longer. They are already at 700,000 people. Those are going to exponentially grow if we have these cuts to Medicaid. My brother Chris is my favorite Medicaid beneficiary. He's 35 and has autism. His services have been the reason that I will always find happy to have Senator Sanders take the seat.
Thank you. Well, thank you all. Thank you all. No.
Hey,
it is not
sir,
Bernie.
Sir.
If there is ever a time in American history where it's not one person but millions of people, this is that time. It's not me, it's you, it's all of us. All right, all of you, I'm sure, have heard, you understand what the cuts to Medicaid are about. If you cut $880 billion from Medicaid, that means millions of children in this country will lose the health care that they have, including some of the most vulnerable kids in our nation. What it means at a time when 2 out of 3 people in nursing homes get supported by Medicaid, and when nursing homes are already in desperate shape, it means that your mom, your dad may not be able to get into a nursing home or may be forced to leave a nursing home. I have worked very hard for a number of years on expanding community health centers. 32 million Americans, including 1 out of 3 in my state of Vermont, use community health centers for primary health care. 40% of the revenue for community health centers comes from Medicaid. Cut Medicaid, they are going to shut down or not be able to provide the quality primary care that the American people need. But I want you all to understand that all of this is taking place in a healthcare system that is already broken. Our job is not just to oppose these horrendous cuts to Medicaid, it's to fight to do what every other major country does. Understand, healthcare is a human right. Healthcare for all. So we look forward to working with you to pass a Medicare for all piece of legislation. But what we have all got to appreciate is what we're looking at right now is not just devastating cuts to Medicaid. We're looking at devastating cuts to nutrition programs. In the richest country on earth, millions of our kids go hungry, are not getting the nutrition that they need. But it's not just Medicaid, it is not just nutrition. Right now, they are cutting away the Social Security Administration. Social Security is already understaffed. They are not responding to the calls that people make. They want to devastate that program so that when people call, they get nothing. Last year, 30,000 people died who are on disability because they couldn't get their benefits on time. If Musk and Trump are successful, tens of thousands more will die. But it's not just Social Security and Medicaid and nutrition. It's the Veterans Administration. These are the people who put their lives on the line to defend this country. They want to fire 80,000 employees at the VA. Now, I don't care what your politics may be. But all over this country, people are sick and tired of seeing the richest guy on earth decimate the federal government and programs that working class people desperately need. Our job in every way that we can is to stop Trumpism and to fight for an agenda that works for all Americans, not just the billionaire class. So brothers and sisters, this is a pivotal moment in American history. We're in it right now. And I've been all over the country, and I believe that no matter what people's politics are, conservative, progressive, independent, Democrat, Republican, people do not want to see Elon Musk running the United States government. So let us stand together. Let's oppose Trumpism. Let's fight for a government and an economy that works for all of us, not just the 1%. Thank you.
I helped administer care, but I never imagined being on this side of the bed. I am here to fight, to save lives. It's hard enough to fight insurance denials and delays with over 848 million claim denials a year. There is no doubt that Medicaid cuts will cost lives, and those people will die suffering. 1 in 5 Americans have access to health care only because of Medicaid. 4 out of 10 children only have access to a doctor because of Medicaid. Over half of Medicaid is spent on people who need long-term care facilities. What happens to those people? Are we going to put them on the street? No! Is the new way to cut taxes for the rich to build cemeteries for the poor and the infirmed? No! Is that the care a veteran deserves? No! Is that the new standard of care for our elders? No! For the disabled? No! Let them die? No! Because making cuts to Medicare and Medicaid will succeed in doing just that. Millions of people are at risk of losing access to care that allows them to work and live dignified lives. Home and community-based care is in danger of closing. Elderly and disabled people will be made homeless, unable to afford rent and medical care, choosing between food and heart medication. I know how hard it is to balance the bills and the health care you need to live. I had to ration my care to keep a roof over my head. I know the shame it caused me to have nothing left to show for myself, having sold it all to stay alive. Instead of cutting Medicaid and taking health care away from people, Congress should do more to make the ultra-wealthy and big corporations pay what they owe. But they're not going to do it unless you act. Use your hands. Pick up the phone. Tell your senators and members of the House you're outraged. Use your bodies. Get down to town hall, district offices, and rallies. Make your voices heard and keep doing it over and over again until they back off and leave our health care alone.
Hi, I'm Dina Stickford, and I'm from ACO, American Community Organizations. I am a leader. Thank you. I'm here to speak about Medicaid. We're very concerned about this. Can you imagine people losing their medical benefits? They would not be able to get the doctor care, therapy care. They would not be able to get their medications, surgeries, oxygen, home care. We're asking that the Congress take in consideration to not vote for cutting Medicare. There are over 88,000 people that are fixing to get cut off of this, and it's very concerning to me. But just think about what's fixing to happen. All our crime rates are fixing to go up. People are going to start self-medicating, and we know what's happening on these streets. People are going to drop. And also, we would like to, I got a little something written down here. We're going to make our voices heard. Any calling on Congress and the Trump administration, and we want them to vote no to cut Medicaid. For me and the millions of Americans, other people who depend on Medicaid to survive. Thank you.
Did she not do great, y'all? Is this not the kind of leadership we need in this moment? Thank you. Thank you so much, Dina. Thank you, Jen. Thank you for your patience. I don't know if you saw Bernie was ready to talk to all of us. Y'all, we know when we fight, we win. Yes. We know that this is going to take everyone. I need to ask you to not only join the fight in this moment, but stay connected. So please take out your phone. It's not to take a picture of me, although you should take a picture of the beautiful day and how you are the most powerful people in America. But I'm going to ask that you please take out your phone and text the word CARE, C-A-R-E, to the number 2543. I'm missing a number, I am certain. Thank you. Mic check. We will text CARE to the number 25463.
You're welcome. Team, colleagues, activists, I am proud to have us close out with the incredible Rachel Fox, who is leading on healthcare access, and the incredible Rob Weissman from Public Citizen. Bring it, y'all.
Hi. It's so nice to see everybody out here defending Medicaid. I'm Rachel Fox. I'm a medical student, and I'm with Students and Physicians for a National Health Program where we where we advocate for a universal, comprehensive, single-payer healthcare system. I used to work in Medicaid financing before med school, and I'd like to tell you a story from that job about how Medicaid saves lives and can save money in healthcare spending in the long run. So, one summer, a hospital contacted my team about a little boy who had well-controlled asthma for the majority of the year, but in the summer he was going to the emergency department multiple times every week with asthma attacks that were caused by the summer heat and humidity because his family couldn't afford air conditioning. So we got him a $100 AC unit for his bedroom window, courtesy of his state's Medicaid program, and his emergency department visits dropped to almost zero. That $100 Medicaid claim ended up saving hundreds of thousands of dollars in healthcare spending and allowed that little boy to have happy, healthy summers. That's just one of a million examples because Medicaid is critical. It's flexible enough to meet individual states' needs, but it's broad enough that every single hospital in the country receives Medicaid funding. It covers innocent kids struggling through the summer break due to their asthma, and 40% of kids in general. It covers new moms and their babies, elderly folks in nursing homes, people living with disabilities, first responders, veterans, people trying to escape poverty, and students like me in half of my med school class. Does any of that sound like waste, fraud, or abuse to you? No, me neither. So, since this administration and their douchebags seem confused about what counts as smart spending, let's give them some examples of what actual waste, fraud, and abuse would look like. Waste would be Trump spending $18 million in taxpayer money to play golf for over a quarter of his days in office. Boom. Fraud would be Medicare Advantage, not traditional Medicare, which we love, but Medicare Advantage, which is run by private health insurance companies and is under investigation for overcharging the Medicare Trust Fund while providing worse services for their enrollees. Boo! Paying more for less is only an advantage if you're a United Healthcare shareholder. And abuse would be Elon Musk, our national parasite, leeching off of our government to get even richer. Boo! So let's tell Congress to work on cutting actual waste, fraud, and abuse instead of slashing Medicaid and access to care for the most vulnerable Americans. I feel so fortunate to have you guys on my side, and from all of us at Students and Physicians for a National Health Program, thank you.
Get a little louder for Rachel. Brothers and sisters, we need to finish up here strong. Can I ask you to get a little closer? Come a little closer. If you're over there, come on in. Come on in. We're going to finish up strong. We got to be strong. We're a united movement. Come on in. Come on in closer. Come on in closer. If you're over here, come on in. Step close. Step close. Step close. Come on. Here we go. Here we go. All right? They're talking. Elon Musk, Donald Trump are big on efficiency. I wanted to say a few words about efficiency. Efficiency is a good thing. It's not the most important thing. When it comes to healthcare, the most important thing is that healthcare is a right. But efficiency is good. Efficiency is good. When you cut spending on HIV and TB and malaria in the developing world, it's not efficient. You're going to lead to more diseases that will come back here. It's not efficient. But more important, it's not right. It's not efficient, but it's not right. If you spread disinformation about vaccines, it's not efficient because vaccines are the most efficient healthcare innovation. It's not efficient, but more important, it's not right. If you cut spending on our health research institutions, it's not efficient. You're mindlessly stupid. It's not efficient, but more important, it's not right. And my friends, if you cut spending on Medicaid, it is not efficient. Speaker after speaker, Rachel and others have just explained the spending that Medicaid does saves us money. So it's not efficient if you cut Medicaid. But most important, it's not right. But as Bernie was telling us, it's not just about what they want to do. It's the system we have right now. The privatized Medicare system we have, so-called Medicare disadvantage, that costs us $100 billion a year. $100 billion a year in waste. That is not efficient. But more important, it's not right. When the drug companies overcharge us with their patent price gouging that costs the country, taxpayers, consumers, at least $200 billion a year. At least $200 billion a year. That's not efficient, but more important, it's not right. And it's not right because not just do we pay too much, people can't get life-saving drugs they need. It's not right. Well, I'll tell you what else. Efficiency is not just about saving money. Efficiency is about spending your money smartly. So if you make an investment and it pays off, that's an efficient investment. So if you expand Medicare so it covers dental and hearing and vision, that's efficient. But you know what else? Healthcare is a right. And if you go beyond that, not just shoring up Medicaid, not just making Medicare stronger, but doing what we all know needs to be done, make Medicare available to all so that we have expanded and improved Medicare for all. It is efficient, but most important, healthcare is a right. Healthcare is a right. Healthcare is a right. Healthcare is a right. When we come together like this, we build the power. We are going to beat this Medicaid cut. We are going to beat this Medicaid cut, but that is not enough. We are building the power and the momentum, not just to stop their cuts, but to make sure that we live in a country where finally healthcare is a right. Thank you, brothers and sisters.
Y'all, there's nothing left to say except recommit to take this fight at home. Again, I'm going to ask you one more time. Raise your fist if you're with me. Raise your fist if you're ready.